Let's shine by seeing the best in all of us and by treating you here, right in your hometown. Let's look out for each other. Let's stay healthy. Let's shine together.
Good evening, and welcome to the first episode of Let's Talk Together, previously known as Read Beside You. For this month's premiere episode, we will be discussing the Watchman procedure for American Heart Month. And what better way to detail this procedure and its benefits than from someone who's experienced it firsthand.
Yes, ma'am.
And we want to welcome our first guest is Larry Harter of Darke County. Welcome, Larry.
Thank you. Thanks for being here, Sharrie.
Tell us a little about yourself.
Well, I am 67 years old. I reside over in the southern western part of Darke County near Arcanum. Live out in the country. I just retired after 35 years working road and bridge construction, and but we still involved in the farming operation of a couple thousand acres over there. My wife's name is Susan. We have been married 38 years. No children, but she works in the medical industry as well, so pretty brief.
Well, great. Well, welcome, Larry. And we know you're on the other side of the Watchman procedure, so let's go back to the beginning.
Yes, ma'am.
And what were your initial symptoms that brought you in, and how were those symptoms affecting your day-to-day activities?
Actually, my AFib started back 17 years ago and had to go to Greenville Hospital, not sure what was going on. Very lightheaded, very angry, and so we started a relationship with Dr. Henry Chong. He informed me what I was going through, which I had no idea. It was called atrial fibrillation, or AFib, heart out of rhythm. So we worked for about 2 or 3 months with medication, and we finally got the heart back in rhythm. And it worked real well for about 8 years, and then we had to have an ablation, which is where they go in and start dying off or killing off some of those little electrodes in the top part of your heart that are misfiring.
So what was your initial reaction when you had that diagnosis of AFib?
Shocked, because I had never really been into a hospital other than the day I was born to have an overnight stay, and it was about a 10-day stay, and other than just normal colds and going in for checkups for hypertension and things of that nature. A little scary for me.
I can imagine. What were some of what was the type of traditional treatment that was implemented?
Well, the first thing they did, like I said, they kept me in there, and they wanted to keep me in the hospital for about 10 days just to watch, because I told them I need to get back to work, and I think that they were concerned that I would get out there too soon before any medications, and they were sure of what was transpiring with my body. So, but again, Dr. Chong was very, very efficient about explaining to me what was going on. If I had any questions, if I disagreed with what was going on, ask him. He was very professional in what he was doing to promote the start of the process with AFib.
So how did that traditional treatment interfere with your everyday activities?
Well, when you have AFib, for those who've been through it personally, you are short of breath, your heart's beating rapidly. The brain is trying to figure out what the body's doing, because you're not getting the proper amount of oxygen and blood flow to the regular part of the body. So it was difficult. So most of those days, in the early days when I went into AFib, I simply just went to bed and laid there till I went back in rhythm. It was very uncomfortable.
And scary.
Yes, ma'am. Yes, ma'am.
So how was the Watchman procedure brought to your attention?
About 5 or 6 years ago, Dr. Chong said, as you grow older, that the procedure, the AFib will probably continue to be a part of my life. So to have a protection plan, he recommended the Watchman procedure. But it was not to his liking at that time. It was not as successful or been proven, so he wanted me to wait. So when I got ready to retire here at the last year, he said, "Are you ready to do procedure?" And I said yes, because my heart at that time was in AFib, and there's a problem there because blood could coagulate in the top part of your heart, and then if it does go back into rhythm with the coagulation of blood, it could send a blood clot through and give you a stroke.
What was the prep for the procedure like?
The Watchman procedure was very simple. Don't eat after midnight. And go into the Reid Hospital and at 11 o'clock on one day, and the procedure was done. And 11 o'clock the next day, I was being taken home by my wife. So very simple operation for me.
That's amazing. So how was your recovery process in the hospital, and then how different was it once you got home?
The hospital staff at Reid were very, very informative for what I can and can't do. When they do the Watchman procedure, like the ablation, they cut the big arteries in the left and right side of your leg. And the big thing they have to worry about is you have to stay pretty still for a couple days to let those heal. If not, if you get too active, they'll break open and there's a possibility that you can bleed out. So I've learned, gotten a little older, be a little more patient and be wise enough to listen to the health professionals who are trying to get me well and get me better. And after about 4 or 5 days, limitations on weightlifting, but other than that, use a normal life.
And you followed the directions, and that's 90% of the challenge. So how's your life changed for you since the Watchman procedure?
Well, last year, 2022, was a difficult year for me. The heart kept going out of rhythm. The Watchman procedure, once it was done, was a good safety valve for someone who was still on AFib. I eventually got cardioversion, which is, those who don't know, they shock you to get your heart back in rhythm. Had that done 5 times. And then after 6 months after the Watchman, Dr. Chong, recommended have another ablation, which is going in and deadening some of those nerves up there. And then after about 8 weeks, went back in rhythm, and here we are. We're feeling good. Again, a little scary, probably more for me since I've been through it for a while. Very frustrating because you can't do what you want to do because you don't have the strength.
So share with us how are you on blood thinners now, and how does having that Watchman make you feel, or does it make you feel safer or more confident?
Well, I have hereditary hypertension in my family, so I've been on medication since I was 25. After the heart was back in rhythm after 8 weeks, Dr. Chong said we can take you off Eliquis, which is blood thinner, and now I'm strictly on baby aspirin and some other medications to still deal with the hypertension. But I feel great. I'm able to do what I want to do. And again, it goes back to the quality and the profession of the people who I dealt with at the Reid Center in Greenville, Ohio.
That's great. So share with us just a typical day for you.
For me, if we're in the fields, you get up in the morning and you figure out what your field work is going to be that day, where you're going to plant, and you go through the process, weather permitting. And on the days that we aren't working in the field, we have a shop right there where I live. We work on our own machinery, so we do a lot of repair work there. And then when those days are slow, I'm gifted enough to get to talk that I've invited to different churches to fill their pulpits and to spread the word. So full life. I mean, even though we don't have children, we have a pet bunny that lives in the house with us. So when I'm not busy with that, she's usually sitting in my lap and taking time there. But a normal lifestyle now. I mean, and since I left the construction business, it's not as intense, not as hard on the body. So I'm learning to slow down and relax a little bit and enjoy retirement.
And you shared with me how you've had a relationship with Dr. Chong for quite some time. Can you expand on that?
We started 17 years ago, like I said, when I turned 50, and I wasn't familiar with being around a lot of different doctors. I just my regular general practitioner, and we started out a little rough relationship. But there you go again. It was probably more me than Dr. Chong, simply because I had not been in that situation before. I did a lot of questioning. The one thing great about the internet system is you can go on there and find a lot of the questions that you have that can be answered. But you've got to be real careful on what you're reading. So what if I had some things that I was not sure about, Dr. Chong would answer my questions. And after about the first 2 or 3 years, we got to have a good relationship. I told Dr. Chong at one time that I was going to be one of his more interesting patients, and at the time he didn't believe it, but now he's in agreement with that.
We have, I'm just curious on when you're saying, so actually, and you're still doing all your farming? That's amazing.
Yes, ma'am. I mean, raised up poor, and we knew how to do things. We just had to go out and work. So, and I enjoy working. I really don't have a lot of different hobbies, and my wife and I don't spend a lot of time eating out occasionally, but I just enjoy the work aspect of it, and probably will be until the day I can't do it anymore. But with the procedures that Reid's done for me, I'm back to where I can do what I want to do. But you have to be a little slower, because of the age aspect, and be a little more cautious. It's great.
So we couldn't start off our new series with a better guest, because you've just been so delightful and just sharing. What would you like our viewers to know?
Not a lot. I'm just an average, white-haired guy. I mean, it's just, I try to go out every day. I'm not a gloomer and doomer, and look at what the gifts that God gives us and the abilities that we have, and go out and glorify and honor Him. But I just appreciate and try to make other people's lives a little more jovial. And I'm more interested in finding out where they're from and what they do and how many children, and just a basic background of the people I deal with. And that makes it for a more comfortable relationship when you see them the next time.
So, well, with that, I want to thank you very much for joining us today. Next, we're going to talk to two members of Reid's medical staff about this service and how it might be the right fit for you.
Let's shine by seeing the best in all of us and by looking out for everyone's well-being. Let's shine by staying true to ourselves while surging toward the future. Let's shine with the best care possible and by treating you here, right in your hometown. Let's look out for each other. Let's stay healthy. Let's shine together.
Thanks for joining us again on Let's Talk Together. And now we have two medical staff from Reid Health, and we have Tyler Evans and Joy Bowlin. Welcome.
Good morning.
And before we get started, tell us a little about yourselves and how you came to Reid. We're going to start with Joy.
I'm a cardiac nurse practitioner, and I've been at Reid for some time now. I started out with background in bedside nursing, working as an RN and working with patients with cardiac arrhythmias and such. And I've been working with cardiology as a nurse practitioner going on 5 years now.
And Tyler.
Yeah, I've been to the hospital for 11 years now. Spent the majority of my bedside experience in the cath lab as a RN there. Got into administration and came back over to my role about 3 years ago now. So working with Joy and all the other practitioners in the heart service line.
Oh, great. Well, we previously had a patient that had experienced the Watchman procedure, and now we've reached the milestone of over 300
Yep.
People that have had the Watchman procedure. So, you want to share with us about that milestone?
So yeah, we hit that end of last year. I think we're actually getting closer to 350 now. We're putting in several of them a week, it seems like. So the pace, the referrals have done really well. Patients have heard about the success and the lifestyle benefits. So Dr. Hahn, Dr. Lee, our team, it's really a collaboration of a lot of people. Our general cardiologists, our referring primary care doctors, our inpatient team has done a really good job of promoting this and educating our patients on the options. So from start to finish, crosses a lot of hands from the office to the procedural area to recovery, but the team has worked really well to streamline the process, and I imagine the next 300 will come much quicker than the first 300 did.
Well, the good part about that is this procedure is right in our neighborhood, done locally. Mm-hmm. So that's a big plus. Mm-hmm. Tell us about the process and how a person can talk with their provider about concerns and walk us through the process of the Watchman.
So patients find out they have AFib from a multitude of different ways. Either their general cardiologist tells them, they go to their primary care doctor, maybe they're admitted, the ER will diagnose them. So the conversation starts there, typically to referral to our cardiology department. Usually you'll see one of our general cardiologists first, who will review your symptoms, review your eligibility for any of your procedures, review medication therapies. Once that's kind of been set in stone and your treatment plan's been put in place, if you're eligible for a Watchman device, you'll then meet with Dr. Hahn, Dr. Lee, and our electrophysiology team, who will work you up, will educate you. We have a Watchman coordinator who her whole job is to streamline the process, provide education, make sure you get the right appointments, the right sequencing events. With the Watchman device, there is a few pre-tests and post-tests they have done to make sure that your anatomy suits the implant and that afterwards the implant is successful. So all of those steps are lined out for you. We try to make it as easy as an itinerary to follow as possible for you. After your implant, during your stay, you'll meet with Joy. She will meet you the morning of your implant. She'll help round on you during your stay. She'll make sure all your questions are answered, make sure your recovery process is as smooth as possible, and then most likely we'll follow up with you some point in the office again. Once you have the implant done, you'll meet with your general cardiologist. They'll discuss hopefully some benefits to your medication regimen, some lifestyle improvements, and then you'll get back to enjoying your life again.
And let's just go backwards. So tell us, what's AFib?
Atrial fibrillation is an irregular heart rhythm. It impacts the top chambers, and the top chambers beat real fast and chaotic with atrial fibrillation. And it puts patients at increased risk of stroke because blood can tend to pool in those top chambers, and specifically in one area called your left atrial appendage is where most of the blood clots form that cause a stroke. So this brings into Watchman, because the Watchman is actually a device to help close up the left atrial appendage, the area where most of the clots form that go to the brain and cause a stroke.
And what are some of the signs and the symptoms a person might have?
So with atrial fibrillation, it really varies patient to patient. There are some people, surprisingly, who actually have no idea they have AFib. They have this arrhythmia occurring off and on, and it can just incidentally be found. Other patients will complain of increased shortness of breath, sometimes chest pain, palpitations, increased fatigue, just kind of feeling off, things like that.
And the actual, we're going to go backwards a little here on when will a person know that they need that Watchman option?
So really, Watchman can benefit patients in several different scenarios. The main thing is it's to help protect you against stroke. Okay, so a lot of times patients will be on blood thinners that they are taking. Some patients have been on this for many years and done well. But the Watchman is a good alternative to being on a blood thinner for the rest of your life. And then there's other patients who already they've had major bleeding, and so they have high risk, and they have high risk of bleeding. And if you stop their blood thinner, then they're not protected against stroke. So Watchman comes in as an alternative instead of being on a blood thinner for the rest of your life. It's a good alternative to help to protect you against stroke, and it just requires basically a short protocol of a blood thinner following the procedure.
And who's at higher risk for with needing the Watchman?
Higher risk, okay.
Yeah.
So one thing would be that we actually have a scoring system that helps us to determine a patient's stroke risk.
Okay.
And that includes things such as their age, other problems that they have, like hypertension, cardiovascular disease, if they've had a history of blood clots, of strokes in the past, multiple other things will play into that, congestive heart failure as well. And so we have like a scoring system that tells us their overall stroke risk. And then as far as the Watchman, it's great for patients who, aren't able to tolerate a blood thinner for the rest of their life, or they've had problems with bleeding. Or also some patients, they never had major bleeding, but they have dizziness a lot. They trip and they fall. And so, if you think about that, you're on a blood thinner and you trip and fall and hit your head, you could have major life-threatening bleeding with that. And so this is really it's kind of a safety thing for patients to be able to get off that blood thinner for the rest of their life, but to still be protected against stroke.
And Tyler, you explained a little bit on the surgical process. So if you're deemed eligible for the Watchman, Could you share that with us, what happens?
Sure. Like I said, there's usually pre-procedural TEE where the doctor will go in and take a closer look at your anatomy, your heart, get the sizing estimates and everything for the device. Morning of your implant, you'll check into our PACU space. The nurses and team will get you ready. They'll prep you like we normally do for all of our EP or catheterization cases. They'll prep your access site, explain procedure risk to you. The anesthesiologist will come in, the cardiology team will come in. Then you'll go across the hallway to our electrophysiology room. You'll get put on a table. You'll get prepped for your procedure. Procedure itself is very quick, typically done in less than an hour. You'll be back to your room. Some patients are even eligible to go home the same day if their procedure is done early in the morning, and you meet some criteria to be safely discharged that same day. If you do stay overnight, it's typically the next morning you're able to go home. So overall, our length of stay is very short for this procedure. Sometimes one day, but others next day discharge. So very quick procedure. You really won't feel any different when you're done. The implant itself is small, closes that appendage off like Joy mentioned. The effects will start coming as you get weaned off your blood thinners and get to enjoy some of the benefits of life without being on blood thinners once you get home.
And what are some of the services that are available once you get home, as like peri-op, any rehab?
Yeah,
What's available?
From start to finish, we have a really robust peri-op clinic that will evaluate you for any kind of surgical risks. They'll help prehab you, they call it, which they'll make sure they get your any diabetes or respiratory issues in line to make sure that recovery is as successful as possible. Once you get home, you can talk to your cardiologist or primary care doctor. We have a really good cardiac rehab program, both in Richmond and our Connorsville and Greenville facilities. So they do a really good job of getting you into rehab, getting you back on your feet again, adjusting to your new lifestyle.
And there's a newer position in your area, the Watchman coordinator. What do they do?
Yeah, she's great. She's been with the office for several years now. So her whole job is to make the process as easy as possible, helps identify patient selection. So she'll review inpatients that have had bleeding complications like Joy mentioned. A lot of people are on AFib with blood thinners and have a GI bleed or a head bleed and other things. So we try to review those patients as high risk for wanting to come off blood thinners. Blood thinners kind of have a stigma as being a bad thing. That they have their place for every patient. Every patient's very different. But for those who would benefit of an option to come off of them, she helps identify those people, provides education for them in the office, assists Joy, Dr. Hahn, and Dr. Lee in the throughput of the procedural process, and really just kind of ties all the loose ends together for you. We'll work with your insurance and everything else to, again, make this as easy as a process as possible.
What's the, give us some examples of like their lifestyle improvement.
Share some stories you've seen.
Yeah, I think, a lot of patients, I hear this a lot, they seem to say, oh, I bruise and I bleed so easy. And like, if you think about a patient that's, been on a blood thinner for years, and especially, if they're doing things around the house, bump themselves, get a big bruise, if they're an outdoorsy kind of person, sometimes there's risks with that. People that are mechanics, like working with tools or any kind of farm equipment, high-risk occupations, things like that. Being on a blood thinner, it creates risks in itself. And so it's great to see them back and like, hey, I'm not bruising like that anymore, once they get off their blood thinner. And just a lot of the safety. I think I could really emphasize the safety. I had seen a patient a while back that had also been involved in a major car accident, and fortunately they had been completely through the Watchman protocol. They were off of their blood thinner. But I thought to myself, had this have been last year before they had the Watchman and when they were on a strong blood thinner, they may not have survived that event. And so it's really, I just think of that safety just comes back to my mind of, for the rest of their life not having to be on that blood thinner.
And it's always impressive to see the medical professionals excited with the outcomes.
Yeah.
I think peace of mind is a big deal for our patients too. Being told you're at a high risk of stroke or bleeding. Those are, anxieties that live with you every day. So to see patients who, like Joy mentioned, can go back outside, can go back to work again and not have to have a fear that something's going to happen all the time. I think that's something that's really kind of undervalued or hard to put a value on, is just feeling like yourself again, or not feeling scared all the time, which is a big deal.
What would be the biggest takeaway you have for our audience on seeing before and after with the Watchman procedure?
It never hurts to ask. You never know if you're eligible. If you feel like you're more fatigued than you are, if you haven't been diagnosed with anything, an EKG is a very quick diagnostic tool they could run, non-invasive. They can give you a quick answer that way. If you know you have AFib, you know you're on blood thinners, a conversation with your doctor takes 1 minute, and the benefits of this last your whole life. So really not much investment of your time or effort up front. Joy, Dr. Hahn, Dr. Lee, there's numerous resources out there that can be available just to talk. We accept self-referrals to our cardiology department, so very easy to get a hold of. We're more than eager to help you and to talk to you and discuss your options. So if you're hesitant and worried it's going to be a long process or it's going to be hard or they're going to ask a lot of uncomfortable questions, it really is about as streamlined as you can ask for a procedure.
And we have how people can get in touch with you on the screen. And we want to thank you both for joining us today on Let's Talk Together.
Thank you.
Thank you.
For more information, you can join us at reidhealth.org and join us next month and Let's Talk Together.
Let's shine by seeing the best in all of us and by looking out for each other. Let's stay healthy. Let's shine together.